everyone. Again, we are back for another episode of the Over the Kitchen's Table with Payne Chapel's Worshiping into Wellness. And we're again doing this series, Dear God, It's Cancer. And today we have Coretta Collins, who is a nurse practitioner, a hematology and oncology nurse practitioner, and she's going to share her perspective as a healthcare provider in terms of cancer when we're having this conversation. Little just even side note, I'm a radiation therapist certified, don't practice as one, but I do have experience. It's been a long time since I've worked in the area, but at least on the research and some patient care, I can provide a little bit of my knowledge as well to fill in the gaps. So we are glad to have you on, Coretta. So just tell me a little bit about yourself and some of your experiences so everyone can know your experiences and why I am glad to have you on today.
Well, first, thank you for having me. It is an honor to be here, and I love this initiative that you all have started. So kudos to you on that. But as Shamitra already mentioned, I am Coretta Collins. I'm a hematology and oncology nurse practitioner, and I have been specifically doing hematology and oncology for about 10 years now. And I've been in nursing overall since about 2007. So I've had a lot of experiences, but oncology and hematology, that's definitely like what I'm passionate about and what I enjoy focusing on because, though it is extremely challenging, it can also be rewarding too. And I love to educate people about cancer prevention and cancer treatment so that because I've found that the more you know about the topic, the better informed you can be, and you can ask the right questions. So I'm glad to be here.
Oh no, this is great. One thing that I want to kind of start off, I know this may be a little bit backwards in our in the series if you're watching this in order. I just want to start off with, what is cancer? Generally speaking, what is cancer? I don't think
generally speaking, cancer is basically your cells. Our body is made up of cells, and they form normally in most cases. And there are different cells for our eyes, they're different from our hair, different from our stomach, or whatever the case. Well, when cancer happens, for whatever reason, those certain cells, it can happen anywhere in the body, they mutate, and then they grow excessively, and they start to take over your good and your healthy cells. And so basically, in a nutshell, cancer is like these bad or damaged cells that kind of mutate and spread for whatever reason. And that's what, oncology is, basically the study and consequently the treatment of these mutated cells.
And so, because cells are everywhere, and that's correct. And to know, am I correct in thinking that cancer can happen anywhere, right?
That's right. Yes, cancer can happen anywhere, and it can spread to anywhere. But usually, how we identify the cancer type is based on where it started. And so I know that's something that people tend to get confused about, or that's always a big question. Like if somebody has cancer that maybe started in their breast, but it went to their lung or went to their liver, people tend to say, oh, she had breast cancer, but now she has lung cancer, liver cancer. It's like, no, she doesn't. She still has breast cancer that has now spread to her lungs and her liver, but it's still the breast cancer. So I think that's something a lot of people, there's a misconception to think. And so I think that's something good for people to know. Like typically, yeah, cancer can happen in any part of the body. And usually the way it gets its name is based on where it starts in the body. And those cancer cells all look different. They have some similarities, but they all look different or have different markers or mutations and different things that we can test for based on where it started too. to help us identify it.
And also, I know some people may or not know, like, what is the difference between, because you hear that word malignant and benign, like, what are
Mm-hmm.
those words? What does that mean?
So if something is malignant, that means it's cancerous. So you can pretty much, malignancy or malignant is synonymous with cancer. If someone says something is benign, that means it's not cancerous. So, benign is going to be more what you want to hear. Like, you want somebody to say it was a benign tumor or a benign lesion, because that means it's not cancerous. If it's malignant, it's cancer.
But then there are times when the benign tumor can be in a bad place, correct?
Absolutely. So
That's
yeah,
when,
benign tumors, can definitely be in a bad place. And it doesn't mean they can just stay there.
yeah.
It just means that once you get them out, it's less likely that they're gonna spread or be more trouble, so to speak. And then there are some tumors that are benign that have a chance of becoming malignant. So you also want to make sure you have them addressed. Just because it's benign doesn't mean you shouldn't do anything. Now, in some cases, yes, some stuff you don't have to worry about, but certain tumors, they have what we call malignant potential, meaning they may be benign now, but over time they could transform.
So what are, and I know there's so many forms of cancer, so we're not even going to go into that topic. But what are, generally speaking, are some treatment options that people can may be able to receive if they receive the cancer diagnosis?
Oh yeah. So in most cases, anytime you're diagnosed with cancer, you're going to encounter at least one of three methods or modes of treatment. And that's going to be surgery. Surgery is if that's an option. And of course, this all depends on like the staging. It all depends on the type of cancer and the stage of the cancer and the location. So keep that in mind. That's the caveat to that. So, but yeah, so surgery, we're going to determine if that's an option, if a person is a candidate for surgery. We're also going to determine if the person is a candidate for something called radiation therapy, which of course, I know you have some experience with that, Shemitria, so you could probably speak more to that aspect. But radiation therapy, that's also an option. Like I say, it depends on the location and the type and what our goals are in terms of treatment. And then there's chemotherapy, or and sometimes under this umbrella, because chemotherapy has come a long way. So we also have a breakdown kind of aside from it. There's immunotherapy, which is kind of its own umbrella now too. But cancer treatment has become more targeted, thankfully, over time. So more targeted therapies, and they can be oral or they can be IV. It's not necessarily just like chemo that people tend to think of that from many years ago, that immediately like make people sick or cause like certain side effects. Now, absolutely, it still does cause certain side effects, but there's definitely much more to it now, and we're much more able to determine which drugs treat which cancers better. So those are going to be the big things that will be considered: surgery, radiation therapy, and then systemic therapy is what I really should say. Because if I say systemic, then that means I'm covering chemotherapy, immunotherapy, targeted therapy, those other kind of treatments there. But those are going to be the main ways. And then, of course, what we really, really want to push or impress upon people is prevention. So, that's like the biggest thing that you can do, is try to prevent cancer from happening, or because early detection is key, prevention and early detection. So, and you maybe we're going to get to this, so don't let me.
No, you can go ahead and start transitioning to that part.
So yeah, so in prevention or early detection, that's where it's like important to make sure you have your mammograms, make sure you get your colonoscopies. If you are a smoker, and have smoked for a long period of time, there is a CT, a chest CT or CAT scan, this is more commonly called, that you can have to help give an idea, show us like what your lungs look like, or be able to help identify. So, and then of course, like for prostate, that'd be, having like your PSA, which is a marker. It's a blood test, not necessarily actually a prostate exam. So you want to try to remember to do those things that you can for yourself for the certain cancers that are going to be, and many of those are the most common. When you think about the types of cancer, right at the top of the list is breast cancer, lung cancer, colorectal cancer. And there's something that we can do to help ourselves for all of those.
Yes.
If we're, if we're kind of like paying attention and so inclined. So, and thankfully, insurance covers most of those screenings. If you don't have insurance, there are different programs that can help you get the screenings done. So you don't want to let that be a deterrent either. I always like to, mention that there are ways, and especially like just as an example for breast cancer, with October being heavily pushed as, Breast Cancer Awareness Month. There are some centers who do so many mammograms, free of charge, or, for people who may not have insurance to get those done or whatever. So you just want to see what resources are available and make sure you're trying to get these things done, and talking to like whoever your primary care providers are, because they should be making like these recommendations and keeping up with when you need certain screenings and stuff too.
Yep. And then if anything feels different, seems different, like, for brain cancers, like a lot of times it starts like headaches or, visual different things. And as some of the guests who are cancer survivors or going through cancer, like they just became a little bit more aware of their body, that there was something different. So if you feel or see or have something different that's unusual that you're not noticing, I think that's really important in talking to somebody.
Yeah, don't ignore stuff, and don't like just take stuff for granted, And what happens like as we age, because the older we get, the higher our risk for cancer becomes, and not just cancer but other things. And also, the older we get, the more likely we're experiencing certain symptoms because we're getting older, right? So we tend to like write things off, like I'm getting older, so yes, my knee is hurting because it's arthritis, or I'm tired, or my back is hurting. But if something is like persistent, you owe it to yourself to at least have it checked out. You don't want to just write it off as old age or getting older, or having overworked it for whatever reason. You definitely, if something is different, pay attention to those signs.
No, that makes sense. So one thing I want to go back to, you said use the word staging. What is the word staging in terms of cancer? What does that mean?
Yeah, so staging is like the system. It's like it's a numeric system, but it's more than just numbers. But you hear for what we call solid tumors specifically is where people tend to know about staging or understand it a little more. Is if you have lung cancer or breast cancer or colon cancer, those are what we call solid tumor cancers, which are different from what we call the blood tumors or blood cancers. So that would be like examples of blood cancers or hematology malignancies would be like non-Hodgkin's lymphoma, or multiple myeloma, or acute leukemia. Those are blood cancers, and they're staged very different from solid tumors. So in general, we have stage 1, 2, 3, and 4. And usually those are denoted by the Roman numerals. But if it's not, that's fine too. Everybody will know what you're talking about. They can, it can get very classified, where it could be like stage 1B or something, and that's more so for like your healthcare team. And it helps kind of direct your treatment depending upon, because we have these guidelines and parameters. And so based on the staging, it helps us guide your treatment. And staging also tells us informs us about your prognosis. So like stage 1 is going to be disease that was caught very early. It has not spread outside of the origin of where it started. Whereas stage 4, if you ever hear somebody say they have stage 4, that means the same thing as saying metastatic disease. Mm-hmm. So metastatic, stage 4, same thing. That means the disease has spread beyond the site of origin. Is now in what would be considered multiple sites, and that is that relates to your prognosis, meaning like the outlook may be poorer, or we're not necessarily aiming to cure, because you technically cannot cure cancer that is metastatic or stage 4, but you can still treat it. Mm-hmm. Whereas somebody with stage 1 or 2, the goal would still be to cure because the cancer was more contained. So hopefully that makes sense. But
no, that makes sense.
It's just important to, to kind of have an idea. So don't be discouraged. Like if you or somebody, your loved one, has a stage 4 cancer, that doesn't mean that there aren't treatments available, because 99% of the cases there are treatments available. And thankfully cancer now has become, whereas it used to be thought of as like an immediate like death sentence, so to speak. Yeah. It's not like that anymore. It's more of a chronic illness in many ways. Yep. Similar to like say high blood pressure or diabetes, something that you are managing and that you live with, but you're taking medications for, or you're getting treatment for. And so even with a lot of the stage 4 cancers, there are treatments, and people are still living years and years having that
decades sometimes.
Yeah. Oh yeah. Yeah. So, so that's the good thing. So, you want to just kind of know, like, that doesn't mean that there's not any hope or anything that can be done. It just, because there, a lot of times there is.
Generally speaking, if somebody is been diagnosed with cancer, what are some key healthcare workers that they may encounter on this journey?
Oh yeah. So let's say, so if you've been diagnosed, it's probably been, well, a couple of the ways it could have been was maybe by a certain blood test, or it could have been because you had you had an x-ray or some kind of imaging, or your mammogram, right? So the people who do that imaging, those are going to be like x-ray technicians or ultrasound technicians. So you're going to meet people who work in like radiology, not to be confused with people who work in radiation oncology.
Yeah.
Because people do get that mixed up, which is understandable because of the way both of the names have radiation, or that radio group. But yeah, so you may you'll meet those people along the way. You'll meet the people who are taking your blood, which could be a medical assistant or a phlebotomist, or or a nurse. It just depends on how the clinics are set up. Of course, the people you're going to encounter first when you walk in is going to be the receptionist, who is hopefully smiling and there to greet you. And then of course the person who's kind of handling your appointments, that's usually a scheduler. You'll probably get a call from somebody who like verifies benefits, deals with like the insurance part of it, or the financial counselor or patient financial advocate. Depending upon the facility, you may encounter oncology nurse navigator. And that role is like very awesome in that that's somebody who can go with the person from the beginning throughout their cancer journey, acting as a point of contact, helps coordinate appointments, make sure you have what you need, because of course getting a cancer diagnosis can be very overwhelming. And it's like a lot of moving parts, a lot of things happen, kind of at once. You're trying to you may be seeing a surgeon to determine whether or not you're a surgical candidate. Then you're going to have to see, like I say, radiation oncology to see if they think you're a candidate to get radiation therapy. And that's where you might meet people like Shemetria, who's a radiation therapist, or a physicist, like those people.
Dosimetrists. There's so many people.
Right.
Yeah.
So it's a lot of moving parts to try to get people the help they need. Now, if you're like on my end of the spectrum, the medical oncology part, you're going to have, definitely like pharmacy, because that's who does like the mixing of the drugs or the dispensing of the medication. And you'll have infusion nurses. And of course, you'll have a hematologist and oncologist. That's the actual physician that specializes in the treatment of cancer or blood disease. So you'll have that. If you're really, really blessed and fortunate, you'll have a hematology and oncology nurse practitioner too.
There you go.
Or physician assistant who can also help you along on the journey. And so that just kind of depends on the structure of the centers that you would go to. So the whole goal, you definitely will see a lot of people along the way, and hopefully you find that the people make the experience better for you as opposed to worse, and kind of help guide you, because there's no doubt that getting a cancer diagnosis is overwhelming. A lot goes into it, and it impacts the patient as well as the family. And so, it's definitely a lot. And you meet a lot of people.
You meet a lot of people.
I encourage people to keep a journal or a notebook.
I do. Me too. Yep, I did.
Yes, to kind of help you kind of keep things straight, because it can be a whole lot. Like for chemotherapy, a lot of times we try not to give that medication directly through the veins. So we may have you see a surgeon to get something called a port implanted, a port place rather. Which is a small, it's like a line, it's a circle little thing that goes right under your chest, within your chest, that we can give you your medicines through it, as well as draw your blood, and keeps you from having to get your veins used so much or stuck in your arm so much too. But yeah, so it's definitely different things. And of course, your cancer care is very specialized. And so what you experience in terms of like the treatment you get is going to be based on what you have, along with the stages, along with what other comorbidities, that means like what other illnesses or diseases that you have, as well as your age, and then like your performance status. Like that means like whether or not you are, still like working full time all the time, running marathons or whatever, as opposed to you not being able to walk 100 feet by yourself. So that kind of thing. So all of those things are taken into account in order to get you the best outcome and the best treatment plan.
No, I love that. And I think like even especially since I work in research, another part in formally working for UAB, like you may see people who are clinical trial specialists who may come and tell you about other treatments, or maybe not in necessarily the medical facility that you're at, but it may be somewhere else that they may refer you to, because there may be a better place or something, a different type of treatment that may be better for you. So
and the genetics.
Oh yes, genetics. Yes,
or genetic counselors. Yeah, that may be somebody else.
Yeah, nutritionists. I mean, there are a lot of people who are there to help you. And from my journey with my father, and even watching, being a part of the system, like it's important to get as many resources, because there are so many resources out there. Even down to the fact that when I used to volunteer with Susan G. Komen, they even have places for people who need to go to chemo and may be working full time and they need somebody to watch a career, like watch their kids, like stuff
Oh
like
yeah.
that. They have those, or people, there are some cancer centers. Well, of course, we know Hope Lodge is there at the American Cancer Society that
Right.
you can take treatment at. But in some, and I think UAB has a Hope, a similar type of lodging, but there's also places that will provide transportation if you don't have
That's right.
transportation. So there are so many things and so many people who like to spend their extra funds. Like when we were just beginning before this recording, I forgot UAB, has changed to the cancer center is now the O'Neill Cancer Center. So there are a lot of people who have a lot of extra funds that they like to spend. So
Oh yeah, they
and they have
have.
a lot of little buckets of money somewhere for people who are in need. So please look at
Mm-hmm.
those resources.
Yeah, and like the social workers and case
Oh
managers
yes,
and
yes,
oncology
yes,
nurse navigators,
yes,
they are
yes.
instrumental in helping with that kind of stuff for sure. And then yeah, and UAB definitely specifically has an excellent like psycho-oncology
Oh
department. So,
yes,
somebody to help take care of like the mental health aspect and provide like counseling and therapy and ways to cope. So, which is another very important piece
a very
too.
important piece.
Mm-hmm.
What made you interested in being a hematologist, oncologist, NP, or nurse practitioner?
Oh
Oh,
yeah.
get
So
into it actually.
yeah, so I like to tell people that hematology and oncology kind of like found me. I was kind of like thrust into it, is the way that I would describe it. And it all started because my mom was diagnosed with ovarian cancer,
Mm,
and I became her primary caregiver during that course. And so, like, I always knew I was going to go into healthcare. Like, I
mhm,
always knew that, I would do something in this realm, but I did not know I would end up in hematology and oncology. Had not
mhm,
even
yeah,
like thought about that as an option.
mhm,
One while I thought I wanted to like work with kids.
mhm. Me
No,
too.
don't want no, not in that look, not in that way. Not in like pediatric nursing, I
Oh,
should say.
okay.
But yeah, so it really kind of stemmed from there, from me like taking care of her, going through her journey with her and noticing like, the relationships that we built
Mhm, mhm,
between her care team, which we just kind of talked about, but especially her nursing care team.
mhm, mhm,
Those were the people, especially like one nurse in particular, who I could call with anything.
mhm.
And so that just really kind of stood out to me and kind of spoke to me. And before my mom passed away, because she did ultimately pass away from ovarian cancer,
Hear that.
she even told me, she was like, man, you would be a really good nurse.
Mhm, mhm,
And so from there, it just kind of set the path in motion
mhm,
even more. And so when I got accepted into nursing school, I knew that I wanted to do hematology and oncology, and that it was just a matter of like, so I tried to make sure I got as many of those kind of experiences as I could.
mhm,
And so it just kind of went from there. And so when I first graduated nursing school, because while I was in nursing school, I worked as a patient care technician
Oh, okay.
in the hospital, or like a CNA kind of, but the
Yeah. Mhm.
hospital calls them PCT or
Teas now.
PCA.
Yeah, they have so many
Yeah,
names now.
yeah.
Yeah.
So I did that as I was going through nursing school, and any chance I got, I was trying to go to the oncology floor, because I spent the initial part of my nursing career was in infectious disease and pulmonary medicine, because there were not any positions available on the oncology floor.
I got you.
But a couple of years later, that ended up changing, and it was divine. It was definitely all God. And it ended up putting me, right where I intended to be, so to speak. And I'm blessed to have, been able to hopefully, impact patients who are dealing with cancer, in a positive way,
Mhm,
and
mhm,
definitely utilize like my experience of having been on the family member side of it,
mhm,
as well as now on the side of actually, helping do like the diagnosis and treatment. It does kind of lend to a unique perspective because
mhm,
I can empathize and, understand from the different aspects.
mhm.
And so but yeah, so that's kind of what led me here, and it's definitely something like you have to be kind of called to
How
do.
to it. Yep,
Like
yep,
nobody, I
yep.
don't think anybody just like decides that they want to work in cancer care. You definitely have to be called to do this kind of work because it can definitely be a lot, and like
Mhm,
I
mhm,
would be lying if I said like all my days were easy. They are not, just as there are great days because you get to experience the
the
successes, or
win.
you
Mhm,
see the remissions, you
mhm,
see
mhm, mhm,
patients have tolerated the treatments great, or the scan shows that things have gone well. Unfortunately, the flip side of that can be where it's the opposite,
mhm, mhm,
and things have gotten worse, or you're having to have the discussions that basically, is no other treatment that we can do, or a person is not able clinically to receive additional treatment. So you got to talk about what that transition looks like into more comfort based care or
mhm,
hospice,
mhm,
palliative
mhm.
care, that kind
Yes,
of thing.
yes.
So
Mhm.
you get get varying ends depending upon the day. It's kind of
Yes.
how that goes. But I definitely, I'm here for a reason. I do think I'm doing God's work in whatever capacity He uses me and has me. So I plan to keep doing it as long as I, as long as He says so.
No,
So
I love it because that's the beauty, and you've seen that on both in the spectrum, like the importance of having people with great attitudes and warm spirits. And I don't know, it's just a connection because those people are going through things that is hard
right.
to conceive. And so having, just even from a regular, even not something as terminal or as life threatening as cancer, but like just even if you're scared to get a shot, it's nice to have a tender touch.
Oh yeah,
Yeah.
absolutely.
And why
Absolutely.
God has created special people in these places
Mhm.
to deal with you. And sometimes through the cancer treatment, people aren't always nice. The patients are not always nice either.
That's
Not
right.
maybe because sometimes that is just their disposition.
Yes.
Sometimes it is because their illness is making them not feel well. So
Mhm.
it's from my experience, it's always great to allow God's light to shine through you when you're practicing, and
Right.
being a provider, because you don't know how much that helps the process or maybe helps somebody else.
Yes, and I totally agree with that. It's so important, so important.
So if you are thinking, if anybody who's watching this is thinking about a career in the cancer care space, it is so many ways that you can do it, from
Absolutely.
where you don't even have to necessarily work with patients if you're very introverted, but then all the
Mhm.
way to being extroverted, being there to hold their hand through. It's so many, so varied, but it's a very special place and it's very much needed especially if you have a caring spirit and want to make a difference.
Yes,
Um,
absolutely.
and it doesn't require, like, even if you want to be something as like the receptionist or administrative assistant to maybe the head of oncology, like there's so many things that may
Vast
not
opportunity.
require a lot of education, and experience, but it's just the spirit
That's right. That's exactly right.
that goes a whole long way.
It does. And that's what people remember, I found.
Mhm. Yes,
That's
most
what they
definitely.
remember.
Most definitely.
Yeah.
Especially those times where it does get dark and bleak. It's like, I remember when such and such said this word to me, or spoke this
Yeah.
word to me, or just smiled at me today because I really had a bad day. Yeah.
Yes, that exactly.
What is your experience like with patients? Like, what is that experience like?
Oh, well, it depends on the patient. But in general, like that is, like my favorite part of what I do is getting to like see the patients, interact with the patients, like, help try to shed some light on what they're going through and help make them feel better the best I can. Like, especially one of my big areas has been like symptom management.
Oh yeah.
So, because, as I mentioned, like, even though chemotherapy has come a long way, it definitely still has side effects. So, it definitely still can cause nausea, it still can cause diarrhea, but there's so much more we can do about the
Mm-hmm.
nausea and diarrhea that maybe we couldn't in the past. And so I like being able to help a patient who has like struggled, getting through their treatment,
Mm.
you know, be able to actually eat a meal, because their nausea is better controlled,
Mm-hmm.
or, not feel so dehydrated, or like they can't go to their kids' activity because they're gonna have to run to the bathroom. So,
Mm-hmm.
I like helping to tweak like their
Oh, I love it.
anti-diarrheal regimen to help them meet like those little goals, because I know
Love
that
it.
stuff like adds up
Mm-hmm.
and it helps with a person's quality of life. So you're already dealing with this life altering situation. So yeah, so that's like I get a lot of joy in helping patients like do or still try to do some of the things that they want to do, and try to help them navigate their treatments and encourage them, along the way. And so some patients, of course, are very receptive, very sweet. But then there are those patients who they don't want to hear anything I gotta say. But what happens is I learn how to navigate them too. And
Mm-hmm.
before the end of it, like we're friends, so it's like they maybe have like shut me out, or kind of have been shut down because that's where they are in the process and what they're dealing with. But before the end of it, you make some headway. And that just kind of comes with like being able to work with people, knowing how to talk to
Mm-hmm.
people,
Mm-hmm.
recognizing like the signs,
Mm-hmm.
so, and kind of being able to pick up certain things. So, and that stuff kind of comes with practice, or, being in this kind of environment. So you kind of know like,
Mm-hmm.
this is not going to work with Mr. Such and such. He is not, trying to hear
Yeah.
that,
Yeah.
whereas it might work with Miss Such and Such. And so those kind of things. So I've definitely, some of my best experiences and like a lot of joy I have gotten in doing this work has been just in helping the patients, period. That's what I like the most. What I don't like the most, one of the things I don't like the most is in healthcare, we have to write so much to document every single thing. And so sometimes
Because
I
we're
do feel
litigious.
like, yeah, it's like if I didn't have to write all this down, I could stay here and talk with you for 30 more minutes. But but you gotta write everything down and make sure. But that's just kind of part of it, the way it works. But yeah, I love like the patient interaction, helping with the families, and I love the education piece.
Mm-hmm. Mm-hmm.
Um, and so because I feel like if you know about your disease and you know about your treatment and kind of what to expect from it, then you get some sense of control back. It's
Yes.
not
Yep. Yep.
just,
Mm-hmm.
and that's like important because, this is already a helpless situation. So by being able to give somebody that back and help them feel like, hey, you do kind of have a choice. If this medicine doesn't work, you got to tell me if this one works or this one works, and then you kind of can make it's like you do have control over something.
Mm-hmm.
It may not be as ideal as you want, but it definitely gives you something. And so, and that's usually my goal. And so I actually helped create at my last practice a education program for patients where it would be like an hour to an hour and a half visit, just going over and answering questions and teaching them about their diagnosis and like their treatment plan.
No, that's important.
So, like whatever the chemotherapies or immunotherapies we're going to use, because we say all of these, big words and, talk about all of this stuff. And a lot of times it can go over a person's head, especially if you're already overwhelmed with what you're dealing with. And so that's usually the time that I can circle back. Like, they've probably like heard you have cancer from the physician. We're going to do XYZ, da, 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 da. Well, then like I'm able to have a visit with them and like really dive into it, break it down. Hopefully they've had some time to kind of process it a little bit and like really ask questions, and listen a little more keenly, and actually hear what I'm saying, so to speak, as opposed to just all sounding, still being so shocking or overwhelming.
No, I love it. Yeah. And I think that's even what, even when I wasn't able to work really as a radiation therapist, because I graduated during the recession, that's actually where I found happiness is, or where my purpose is, and the reason why, this was created and me going back and get my master's. Like I have done more education for my friends and family. And when my dad went through, because as intelligent as both of my parents were, they just were still processing it. So I was able to step back from being Shemetria, the daughter sometimes, and being their in-between partner and liaison to help them navigate through things. And that has been a blessing in itself, because I have this whole wealth of knowledge.
Yes.
That most people, even people who are in healthcare, but that's such a specific type of thing that that I learned, and I was like, okay, well, this is what this means. This is what this means, and these are the kind of questions to help ask when you go back to the doctor, so that you can be more empowered. Or like I'm always telling people, like you just said, this doesn't, I know it sounds like a death sentence, but it's not. Like, let's think about this when we come to like, let's walk and think through this so we can ease up into our options, because I know people are rushing, and unfortunately that's the way the healthcare system is now turning towards, where it's herding cattle, where you don't feel as comfortable. But there are a lot of people that are still there they're there to help you. But sometimes the busyness of the day may seem like you're disregarded and uncared for.
Exactly. Yep. So important.
We kind of talked about some advice about a little bit on some advice about prevention, but what are some general tips? Or I loved how you said, what are some questions that people can ask if they want to prevent cancer from getting cancer? Or what are some important questions that they should ask?
So, a big one is like knowing when you should get your mammogram. I still like to use 40 as my frame of reference. Some of if you look at like some of the guidelines, they have pushed it to like 45. But like I say, I still like to say 40, because most of the time insurance is gonna still pay for it. And in Black women specifically, breast cancer tends to be the more aggressive form, and it is almost always caught in later stages, especially compared to our white or Caucasian counterparts. So I say at least by 40, you need to be having a mammogram. In some cases, you could even have some like OBGYNs or primary care, especially depending upon your family history, you can get what's called like a baseline mammogram as early as like age 35. So that's just something you want to just kind of, have as a ding, like, maybe this is something I need to check on and see. And same thing similarly with getting a colonoscopy. So colon cancer can be prevented by getting your colonoscopy. And 50 used to be the golden age. Now that has been backed up for everybody at this point. So now that's going to be 45. And depending upon your family history, that could be even sooner too.
Mm-hmm, mm-hmm.
And if you're like super opposed to having a colonoscopy, there is even the stool specimen test that does have some validity. Now, it does not replace a colonoscopy, but it definitely is something, and typically a lot of times people will use that like in the older population, because technically it just kind of depends, like after you're 70, 75, in terms of whether or not you're still getting a routine colonoscopy or how routine it is. That just that's going to kind of vary based on the condition you're in and your history. But just as a rule of thumb, if you are nearing 40 or past 40 and hadn't had a mammogram, you definitely want to do that. If you're 45 or getting there and haven't considered a colonoscopy, you definitely want to do that. If you are a smoker, you want to consider quitting. So smoking basically increases your risk of pretty much every cancer on earth that you can think of. Smoking increases your risk. And not necessarily just smoking, just tobacco use. So, we have to be more technical these days, because, I had patients like, well, do you smoke? And it's like, no, I don't smoke.
Tobacco,
but they're they may dip or use stuff, different, vaping. So you want to make sure any of that stuff is going to increase your risk. So smoking cessation is definitely encouraged. At 1-800-QUIT NOW can get people started in terms of smoking cessation. Another big risk factor for cancer is obesity. That one, of course, and that not just for cancer, but for a lot of other health conditions that especially like Black people experience, which would be like hypertension, diabetes, cholesterol, those kind of things. So you want to be as active as you can, and you want to just any like small steps or small things you can do, because nobody's saying you're going to, lose 100 pounds overnight, but whatever you can do to help make you healthier, that's what you want to try to do. So if you, I like to use as an example, like, I had a patient before, and he drank, and this was without fail, he was drinking 15 Cokes a day. Well, if you're able to cut that down by, if you can get that down to 14 Cokes within 2 weeks, you making progress. It's not going to be overnight. So that's the whole point. If you are able to cut out one, bad meal for some fresh veggies, that's progress. And that's what you want to do. If you're able to walk when you go to the grocery store, don't try to wait for that very first part. Like if you those extra little steps, and before you know it, you're gonna be like hopefully doing more. Like all of that stuff helps. It kind of plays a part, but it's also good to know your family history. And so that's a big thing. And then, a lot of times in the Black community too, sometimes we can be like so secretive. But if we would be a little more open, especially with our family members, you just don't know how helpful that can be. I mean, I kid you not, I have, just to drive this point home, to hopefully illustrate, there has been a time where I have taken care of 2 sisters and a niece, and neither of them knew that their sister and niece was being seen.
What?
Yes. And they all had cancer, a specific type of cancer. And, and I could not share. And the way I figured it out was just like through different kind of conversation. Because like I said, they were all my patients, or like medical emergency, like contact. And it was like, wait, hold on.
Same one.
And so that kind of thing. And so it's like, you just want to, if you can, because especially now with like, genetic testing and a lot of these things can be hereditary, or certain syndromes can run through families, or certain like in breast cancer, you probably have heard about like BRCA mutation or
Mm-hmm,
BRCA,
mm-hmm,
just as one example. Well, that's something that's like spread through families, or that families would know. But if nobody is like sharing the information, or if everybody wants to be like really secretive about it, you could end up doing a disservice to your other family members. And so that's just something to consider in general,
yeah,
thinking about, like, because very often in healthcare, you ask people about their family history and they cannot tell you.
yep.
Or they know that somebody had cancer, but they don't know exactly who it was or what kind it was.
Mm-hmm,
So
mm-hmm.
that, I think it's important that we start like calling it out, saying what it is, because it can only help,
Mm-hmm.
in the long run. But that's another soapbox, so I won't get on that.
No, this has been so super helpful. I think that a lot of what you're saying is going to be very helpful and reiterate some of the things that I have talked about during Over the Kitchen Table, and why education and having conversations, and even having these kind of conversations, you know, I love it when I get to talk to healthcare providers, because that it makes it real for people that you all are just is human and have these emotions, and can, in more relaxed environments, can be able to share their professional thoughts, but at the same time how it affects our community, and what you've seen, and in just plain terms, because you have such a limited time during this process. And is I want to thank you on behalf of the the non-medical community and the medical community for being such a great healthcare provider and dedicating your life to aiding someone during a very trying time, and allowing God to use you through this way. And I wish much success in your career, and that people can experience his spirit through you, even people who don't believe in God, like they can experience his warmth through you, especially during this thing. So it may have been a bad kind of a bad experience for why you end up choosing this field, but it was divine. It was very divine.
Absolutely. I totally agree with that. Yeah,
So,
I
any
definitely.
parting words that you have for anybody, or want to share any advice or anything you want to give anybody who's interested in this field, anybody, through this process, through this cancer process, anything else?
Yeah, I mean, I think I've touched on a lot of it, but I will just, reiterate the importance of paying attention to your body, and, not just writing things off. Like, you definitely want to be advocates for yourself. That's another big thing I try to tell people. Advocate for yourself, ask the questions, and hopefully, prayerfully, you're going to have somebody in your corner that's going to be honest with you and help you like navigate as you go through. But I just appreciate you guys having me. I do talk about some of the stuff we've talked about on my blog,
Oh,
that
cool.
I
Share that
haven't
with
been
everybody.
quite as active on lately, because I'm also like back in school, and just a
Yeah,
lot of
yeah.
stuff. But it's you can find it at ccthenp.com. So just like www.ccthenp.com. It's called Confessions of a Nurse Practitioner. And on there are different tabs, and one of them is specifically speaks to cancer. There's one that speaks to like grief and loss, and health and wellness is another one. And so on there you can find like different things that I have like written about or have discussed previously that could help.
I'm so glad that you were on today. And hopefully somebody can be blessed in some information. And if you are fortunate, or I'm going to say fortunate enough to go to the UAB Cancer Center, and you actually have this NP as a part of your care team, you know where you know you're
Yep,
gonna be
I'll
in
be there.
great hands. Or if you had her in the past, we know that you were in great hands. So I thank you for being on here.
Thank you for having me.